Hi, this is Dr. Jim Anderson from Anderson Podiatry Center, and as you can see, I'm standing outside of our operating room here, and I'm here to talk to you about plantar fasciitis. And I know a lot of you see this and maybe you get chills or something. A lot of you don't want to go in there. I don't want to go in there, and but it does happen sometimes that we treat people with surgery for plantar fasciitis. And I'm going to talk to you kind of about a hybrid treatment. It's not like real surgery, but it's sort of like surgery. And it's something that you probably have very little awareness of. First of all, it's a combination of doing a minor surgical procedure and doing a regenerative medicine procedure. I was one of the first doctors in the country to start doing regenerative medicine with stem cell for plantar fasciitis. And years ago we did what was called PRP, platelet-enriched plasma, taking your blood and processing it and injecting it into the plantar fascia. And now we've resorted to usually placenta cell. But here's my point. We know that the fascia is not really inflamed. There's quite a few studies to back up that it's degenerating. It's what we call plantar fasciosis. So we want it to be regenerated, and that's where stem cell comes into play. Stem cell can work really well, regenerative medicine, same thing. So we do that. But sometimes we do another process called a plantar fasciectomy. What does that mean? We actually go in here to the OR and we numb you up, but we make a little poke on the inside of your heel. So just a review real quick. The fascia runs from the bottom of the heel to the arch or out to the ball foot, and where it attaches the heel, that's where the pain is, and that's where we direct our attention. So we use ultrasound guidance so we can look inside the heel in the operating room and actually see where the fascia is attaching, and then we take a device that's called a K-wire. It's kind of like a stiff wire. It's sterile, of course, and it's threaded, and we're placing it in there and we're kind of roughening up the fascia. Why do we do that? Well, the trauma that we're creating helps the body to want to repair it even more. So you're combining stem cell, which helps it be repaired, and the trauma of this needling effect. And it's called a plantar fasciectomy in combination with the stem cell. So that's something we do. It's very easy recovery. You just have a Band-Aid, there's no stitches, and we think it enhances the stem cell treatment. Okay? So that's really important. It enhances and complements it. So that is done together, and sometimes we might even recommend, in combination with that, something called shockwave. Shockwave is like lithotripsy, where they break up kidney stones, and that's using powerful sound waves that are focused in a precise area where they need to go to break up kidney stones. Shockwave is another version of lithotripsy that we've been doing for heel pain for, probably 12 years now. And it sends sound waves into the heel. You have to do usually a series of at least 3, but those sound waves break up the fascia. Again, the trauma, I call it the meat tenderizer, makes your body want to repair it. So we do those 3 things. Stem cell, we can do it by itself, but sometimes we use the plantar fasciectomy with the K-wire, the wire going into the heel, and then, which again, you can shower the next day. It's a very simple layup. And number 3, you might use shockwave. So we do combinations of those, or one of them. So I just want you to know these are all the things that we do here. The point I want to make with this is these are scientifically based. They're really directed at repairing the fascia. I mean, a lot of people, you're doing this on your own, night splints, rollers, stretching, all those things are okay, but in many cases they're not going to get you to the end point. So those are the things I want you to know that we offer here. And if you enjoy this content, I hope you keep learning more from us, because I love teaching. And please comment if you will. And also I ask that you consider subscribing, and just click on the subscribe button there.